Hello, everybody, again. Part two, Dr. Hal Huggins. He graduated from the University of Nebraska in '62. In 1973, he became involved in the study and research of mercury toxicity and impact on human health. He earned his master's degree from University of Colorado in 1989, and a special emphasis in toxicology and immunology. Let's introduce Dr. Hal Huggins. Thank you.
Okay, you ready for the disclaimer? Does everybody have that memorized? Yeah, I do not have any financial interest in any product. I'm not sure about that because last year I put $57,000 into a laboratory that came up with some of these results. That was not much of a return, it was a giving. But I haven't gotten anything back from it except a few comments from the Dental Association who doesn't appreciate what I'm going to be telling you this afternoon. Okay? All right. Okay. It may not look like there is a connection between Lyme disease and bone grafts, and the main reason for that is that there isn't any. But they happen to be two things I was going to talk about because there are some things we need to know about Lyme disease, and that is that Lyme disease and dentistry, mercury toxicity, look a lot alike. If we look at the symptoms, the thing that bothers me about Lyme disease is that it is primarily diagnosed by symptoms. And there's something like 23 of the 26 symptoms are identical. The difference between Lyme disease and mercury toxicity, number one is the rash. There's a target, the little like the store Target, which I don't own. That appears in Lyme disease. We do not see it in mercury toxicity. Reduced body temperature we see in mercury. You don't necessarily see that in Lyme disease. But you can see the rest of these as well as the next slide. Painful joints, weakness, numbness and tingling in particular, that's a big prerequisite for neurological disease created by mercury. Tachycardia, memory, paralysis, all of these things are the same. Awkward gait. Now, here's one, the last one down there, the CSF antibodies. There is a difference there, and this is one of the problems because if you are testing blood or urine, you can test both for Lyme disease. Urine is a lot easier. You don't have as much contamination from other things. There's a lot going on in the blood that you don't see in the urine. That's why it's easier. But with the antibody titer, one of the problems is the accuracy on Lyme disease using the antibodies. If you have an antigen there, the spirochete, the immune system builds an antibody to fight it. Well, if you test it, the accuracy, depending on the type of test, runs between 34 and 68%. That's not very high accuracy, but there is a problem that's even worse than accuracy, and that is that if the immune system does recognize that Lyme is present, that the spirochete is there, it produces memory cells, memory lymphocytes, that hang around for 2 or 3 years. So if you come in, say you have a treatment, your treatment's 6 months, the treatment works. You do another test at 6 months, and the test tells you, no, you still have Lyme disease because you've got 2 to 3 years of those antibodies still hanging around. But we have had primarily one of the spirochetes in the U.S. Now we're getting them from Peru. We're getting them from other countries, so that there are 4 or 5 different microbes that can create Lyme disease, each one of them giving a slightly different profile, but each one of them requiring a different antibiotic. So if you're going to use antibiotics to fight it, then you can't just say, well, yeah, Lyme is here because of 20 symptoms and pick an antibiotic. You're not apt to pick the right antibiotic. And in antibiotics, I will just drop this one out there, that I went without using antibiotics for probably 45 years. Occasionally, once or twice a year, yes, I would use it. But I found more problems than solutions with antibiotics. And now we are, for the last, 3 years, have been using antibiotics, but we are using low-dose bacteriostatics. Most of the antibiotics are bactericidal. And one thing that happens with the bactericidal is it's not like John Wayne. Nobody remembers John Wayne. Clint Eastwood. You know, if the bad guy's over there, he lets him have it, he falls over dead. I thought that's how antibiotics worked. It is not. The bactericidals, when they hit a bacterium, it explodes. And it may go into 100 fragments, which are called endotoxin. Now the immune system has about 100 little endotoxins to take care of instead of one bacterium. So the same holds true when you are fighting Lyme disease. Make sure what you've got is not an overlap with dentistry, and then find out which bug it is you're targeting, find out which antibiotic works on it, and find out if there is a bacteriostatic that stops reproduction, that does not create all this endotoxin mess that the immune system has to fight. Now, on the gels, you'll find here are several of the different bacteria up there, and you'll see that there are differences in intensity. The two in the middle here, and I don't know who it is who designs the names for bacteria and their toxins, but he doesn't speak English. So I'm not even going to attempt to talk about these things by name, but you will see that some of them are bright yellow. Okay, that means high intensity, and over on the left, not quite so intense. The technicians in the laboratories can usually, on a scale of 1 to 10, differentiate plus minus 1. If they're looking, well, I think it's a 3. I think it's a 4. No, it's a 3. They will come fairly close. There's a new piece of equipment coming on the market. It is available in Europe today that can quantify how much is there. And I think this is going to be very worthwhile in future DNA. So if you're using DNA laboratories, see if you can find some place that can quantify as well as qualify what bacterium it is that you're working with. Now, what's this thing down here on the bottom? This is called the ladder. It is present up at the top also. Just for your information, this is what you use as a marker. We might think of it more like molecular weight. It's actually the number of base pairs that are present, but most of us were familiar with atomic weight in our schooling. So if we know that the two bright ones are 500 and 1,000, this gives you an idea when you're looking across to the left, do you really have that bacterium in the crosshairs? And here you can see the positive test for Lyme. It is pretty positive. The one nice thing about DNA is you have two answers, yes and no, positive, negative. It's there, it's not there. There is none of this 36%, 34% to 68%. Either the DNA is identified or it is not identified. So it's very, very much easier to work with. And shifting gears from there into to the bone problems, we have to go through some of the steps in root canals too. Because back in about 1909, Edward Rosenau, who was head of microbiology research at Mayo's, discovered that if you take a root canal tooth and take it out of a person who had a disease, implant it in an animal like a rabbit, the rabbit would develop the same disease and die of it in a very short period of time. He took this information and passed it on to Weston Price. The Dental Association claims they have proved Price was wrong on everything he did. Well, that is 100% fraudulent. They have not proved anything he did was wrong because he had microbiology slides, they had cultures, they had autopsies, they had blood chemistries, they had the history of the patients, they had everything that Mayo's had. So they're very substantial. The only problem was it hit the finances of dentistry. Now, in transferring disease, they found that something like heart disease, they could transfer from the person, the human who had the heart attack, into the animal, where the animal would have a heart attack. That could be transferred 100% of the time. Now, their ordinary studies were 30. They took one root canal tooth and passed it through 30 rabbits, and all 30 of them had to die from that one root canal tooth. This is an important concept. Now, one of the reasons that 100% was reached may be the fact, if you look over here on the right side, you see we've got 28 different bacteria that are found in root canals that are related in the scientific literature to heart disease, heart attacks in particular. So the chances of having a root canal and the chances of it having 10 or more bacteria are pretty high. All right, the chances of 2 or 3 of these bacteria being part of those is also high enough to give that 100% transfer factor. The lowest transfer factors that I saw in Price's work were 88%. That 88% of the time they could still transfer a disease into an animal, even if it was kind of a strange disease. Now, in using implants, implants for the most part have bone graft material, usually cadaver bone, but it doesn't make a whole lot of difference. Autogenous do the same thing. So I'm trying to kind of pull these together because the target is bone grafts. This is a thing that I think you should be very much aware of because none of this material has ever been presented before. But implants are getting to be the popular thing to do in dentistry today. Why? Well, for dentures, nobody likes a lower denture. They rattle around. Aesthetics, ease of cleaning, no necessity of cutting down adjacent teeth. Hey, this is a good selling point. They are considered metal-free, some of them. Another reason to use it is to reduce the loss of bone height and osseointegration. I don't think I have my slides on osseointegration here, but in osseointegration you can see that there is a little white line forming here. That little white line, I suggest, is condensing osteitis. It is the body forming a shield around a toxic material. It is not osseointegration. I would like for you to consider that. Now, the one thing that rather irritates me is we hear a whole lot in Colorado, at least, that if I take your tooth out, if we don't put a bone graft in there, your face is going to collapse. Well, there are people who have collapsed faces. We're talking about taking out one tooth. All right, what if you take out 4 third molars and 4 bicuspids? That's 8 teeth. Do you see a collapsed face there? Talk to your orthodontist. Talk to people who are into facial growth and development. Yes, you can definitely see if somebody has had 4 bicuspids removed. They do have a collapsed face. Personally, I have a big problem with this, that you have to have a bone graft because your face is going to collapse. I have heard that in some really serious cases where people very nearly came down with terminal diseases, and now I can see why. Next. Horizontal bone resorption. All right, let's look at what's in the literature. In the literature, from an ordinary extraction that does not require a whole lot of extra surgery, bone reduction, and so forth, you will lose 4 to 4.5 millimeters. If you put in implant bone around there, you will lose 4 to 4.5 millimeters. To me, this does not justify putting in bone grafts. Now, I think we all had Lester Burkett's oral medicine textbooks. I knew Lester Burkett personally. He was quite supportive of the work that we were doing in body chemistry and blood chemistry. And he did bring up a couple of questions to my mind. Oh, which this is not one of those questions. Let's try one forward from here. No, let's come back to this. He was talking about the dangers here, and then Jerry Bocoup, some of you are familiar with Jerry Bocoup. Blanche, I keep forgetting what the number of seconds is. Bone cells will die when deprived of a blood supply for how many minutes?
35 seconds.
35 seconds?
That's less than a minute.
That's half a minute. Yeah. So it would be dead.
That's right. Even if it's autogenous bone taken from somebody's hip, somebody's mental bone, somebody's ramus, the surgeon has to be faster than quick draw McGraw to get it in the right spot and get circulation reestablished in less than 35 minutes.
35 seconds. Yes.
And I drive in the left lane and I still can't go that fast.
I will attest to the fact that she may be able to go that fast. You do have competition from my office, though.
I know. She drives fast, too.
Yeah. Yeah. There are 2 Bobbsey twins here can both crowd the 3-digit mark on the speedometer very rapidly. All right. If it's dead in 35 seconds, what is it if you give it gamma radiation? That's X-ray. Now, keep in mind that all of these things that are mentioned are methodologies that are reported to sterilize cadaver bone. Ethylene oxide gas is touted very heavily in the literature. You can soak it in antibiotics for 24 hours, centrifugation, ultrasonic vibrations, detergents, alcohol, hydrogen peroxide. These are reported in the literature. If we were to buy a bone graft, we would expect that it had some kind of guarantee some kind of, which combination did you use? How did you show it was sterilized before or afterwards? There are only 2 states that require registration for body parts. And there's a fellow the other day, I was just sent the information, where he would go into mortuaries, take out the spine, put in polyethylene, is that what? No, a pipe, the plastic pipe, whatever that is, PVC. He would put that in and harvest organs and take those and sell them for being fresh. They may have been 2 to 3 days old. They can make anywhere from $40,000 to $100,000 from one body going into a mortuary doing that. And this fellow had done 1,000 of them when he got caught. And it so happened he was a dentist. And he was selling this spinal column stuff as bone graft material. There are 2 states that test for sterility, and the test for sterility is testing for HIV and testing for hepatitis. And that's all they test for. So we have 4 states out of 50 that have anything to do with monitoring bone grafts, and that is pretty slim. And if you notice, the FDA considers 10 to the minus third as, quote, sterile. That's 1,000 bacteria per cc. It can be called sterile. And CDC considers 10 to the minus 6. That's 1 million bacteria per cc is still considered sterile. There are some people in this room who are as mean as I am. Don't happen to be the same sex, but certainly that's all right. I've got to learn to walk without this anyway. This next step was thanks to Dr. Blanche Gruby, who bought some sterile bone graft material. And she said, if you pay for the testing on this, I will pay for the bone graft. Well, as it turned out, we were using a university laboratory for our DNAs at that time. And somebody forgot to mail it. The people with these brown trucks driving around forgot to delay. I don't know. There were a whole lot of things that went wrong. Our shipment went out, and a day later, we got Blanche's. Well, we do have something we call Deep 7. Deep 7 is a deep freeze. It is 7 feet tall, and it goes to 72 to below zero. Skin breaks at 55 below zero. So we have this thing full of body parts. Primarily teeth. But we put this sample in at 72 below zero, and after a couple of weeks we noticed it was growing whiskers. Now, what that is sterile is going to grow whiskers at 72 below zero? Well, we tested that, and we found 54 pathogens in that sterile bone graft material. And you can't see these from there, but you can see there's a difference in color. You can see that some of them are kind of a reddish orange. These are the ones where the immune system is doing nothing to curtail the activity of those bacteria. So you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. You got a whole bunch of them here that the immune system could do nothing about. Now, if we take a select few from this sample of sterile bone that could have gone into somebody that didn't because Blanche bought it. This is what they were saved from. The Actinobacter baumannii is the flesh-eating bacteria. It is also called the Iraqi bacteria because a lot of it is coming back from Iraq. But we do hear about flesh-eating bacteria. Who would want that? Central nervous system infections, sinus. What's the relationship there? There is no relationship there. And the supercalifragilisticexpialidocious here gives endocarditis, heart problems, periodontal disease. Yeah, big deal. Hemolytic. Bacillus cereus is called B. cereus. And hemolytic problems are big, and they're hard to stop if you don't know where they're coming from. We have seen reports of people running hematocrits of 44, 45, 46%, very good hematocrit. That's the percentage of blood that is composed of red blood cells. Running these levels for years, and all of a sudden it drops 10%. That's like losing a quart or more of blood. What are you going to do? Well, throw in some antibiotics. Which one? How do you know it's Bacillus cereus? You're going to have to do a lot of testing. We do 93 tests on the blood for bacteria. You're going to have to do those because we don't find B. cereus more than about 15 or 20% of the time. But if you are going into chronic fatigue, if you're losing B12, you're losing folic acid, you're on a high-protein diet, these things don't make sense. But look at what else we've got. Heart attacks, immune suppression. Immune suppression, that's about as general a term as you can come up with. What does it lead to? It leads to about anything. Brain abscesses, you see a lot of those in dentists. A real severe type of pneumonia, bone infections that can move around, they can metastasize. Another one for endocarditis. Let's see the next slide. This is just a small sample of that one bone graft. Which disease would the patient have come up with? E. coli appears a fair amount of time. The colon cancer is going to be very popular. But the porins we have a big problem with. Porins, P-O-R-I-N, is a word that means we are forming pores or holes in red blood cells or in some of the white blood cells. But you bore holes in the red blood cells, you lose your red cell count, you lose your hemoglobin, you lose the hematocrit, and you have no idea where it came from because it came from this little tiny piece of bone graft. The Klebsiella for lung destruction, man, is that a hard one to take care of. And then, I suppose my true childhood Southern raisin is showing up here, because when I first saw this one, there was no way I could pronounce it except what I remembered from the South, that this bacteria was okra and apple pie. Now Bob's taught me it's Ochrobacterium anthropi, but around the office we still talk about apple pie. We talk about it a great deal because it is related, according to Huggins, to Lou Gehrig's disease. Finally, we broke our pattern. We have 18 Lou Gehrig's disease. 17 out of the 18 show the Ochrobacterium anthropi. It looked to me with 17 out of 17 like we had a true causative factor, because it does some strange things in people, things that will throw the doctor for a loop. If you have high blood pressure and you have a high systolic and a high diastolic, what's your pulse going to be? That's going to be high. No, it's going to be low if you have the anthropi there. So these are things we're looking for now in Lou Gehrig's disease. So does that mean this patient could come down with Lou Gehrig's disease? Is it worth finding out? So these are the things that could have happened, and thanks to Blanche, did not happen. Now, the CDC published aseptically processed tissue, which is what your bone grafts are, should not be considered sterile. Now, that information was on the package that you got when you got your little package of sterile bone, was it? Did you see that? I don't think so. Now, one thing I have quoted over 1,000 times is from Dr. Douglas Schwarzenegger, Schwarzenegger from University of Colorado. Anything, that's the important word, anything implanted in bone will create an autoimmune disease. The only difference is the length of time. So we have information now on the newest material that is being used in implants. It is no better than stainless steel or anything else. Anything implanted in bone. And someday you may need to know that this is what's coming back to bite you in the heel. That you thought an autogenous bone graft was going to be okay. They are not okay. We have studied those, and we find them saturated with the same pathogens that we find here in the cadaver bone. Now, we have a couple of cases that we cannot follow up on because we don't know who they are, but they have been reported to us of people who have died of a disease that only Asians get. Caucasians never get them. And if you take a piece of bone from an Asian who died of that disease, stick it in a Caucasian, you are giving them an opportunity to also become a cadaver. So I expand this a little bit, that any time you take cadaver bone and put it in a living human, you just gave them the invitation to become a cadaver. And I would really like for you to consider that. I have treated patients who have had bone grafts, who have had implants, and who have reacted to them. You know my feelings on mercury. Mercury is really bad. You know my feelings on root canals, that root canals are terrible. My feelings on implants is that they are satanic. They cross the line from working with these patients, seeing what happens to them, seeing their changes in attitude. You've crossed over and damaged the soul. Consider that, please. This is the top method of science that is available today. This is not opinion. Investigate before you integrate. Investigate what's going on. If you're going to put in a bone graft, have it tested first to see if it's sterile. See if something sterile can really come back to life. In my work in immunology, I learned about the major histocompatibility complex. The major histocompatibility complex, MHC, is your code. It is your code on your cell that shows this is you. This is what keeps you alive. And from what I can see, and I have tested this with professors of immunology, when you have a root canal tooth or an implant, there is no MHC. If there is no MHC, you have something that will create an autoimmune disease. So there.